Hello, and thank you for choosing to watch this webinar, which is called My Cat is Pale. My name's Sarah Caney. I'm a UK-based specialist in feline medicine, and I've included my email address and my website address on this slide. And if you do want a copy of the slides that I've used in this presentation, or if you have questions, you're welcome to send me an email, and I would of course be delighted if you choose to visit my website as well. I have no relevant conflicts of interest to disclose. So the plan for this short presentation is to talk about pallor in cats and to remind ourselves of what an appropriate list of differential diagnoses for pallor might include, and then to concentrate on aspects of the history and physical examination that allow us to further understand in an individual cat what is the cause of their pallor, and therefore hopefully to reach the correct diagnosis which is going to lead to the most appropriate treatment plan. And for reasons that you will not be surprised to hear, we're going to be really focusing a lot on anemia as a major cause of pallor in cats, and where there is a fairly well acknowledged path in terms of approach to diagnosis, but I'll of course present my personal approach to that path during this lecture. So this is a list that I put together of causes of pallor, and of course anemia is very importantly on the list and at the top of the list, and I'm sure by selecting to listen to this webinar, very much on your list was thinking, well, what is the approach to diagnosis of anemia in cats? Or that might be part of the reason that you're choosing to listen to this. But it is important to remind ourselves that there are other differential diagnoses which we need to consider and include, many of which will become apparent through our history and physical examination and allow us to then focus on them. But at this very early stage, where perhaps all we know over the phone is my cat is pale, this gives us a starting point for what we should think about. So I've included cardiovascular possibilities, circulatory possibilities. Also a reminder here that we need to differentiate between perhaps a more generalised condition and a more localised condition, because a localised pallor could be because of a localised issue rather than a general issue. So that's our starting point in terms of differential diagnoses. Moving on to the history, we're going to want to understand, well, how acute is this condition from the owner's perspective, bearing in mind that cats are so good at adjusting to illness that often chronic diseases will present acutely in the world of feline medicine, simply because cats will reach a threshold at eventually, at which point they can't cope, but that may not actually indicate that it is indeed an acute problem. It just could be that it's taken some time for that chronic disease to reach that point. However, nonetheless, it's important for us to understand from the owner perspective, have there been any inklings in the past that something is wrong, or is this genuinely a very acute situation? What do we know about the cat's previous medical conditions? What's on its notes already? Are there perhaps medications which might make the cat vulnerable to anemia through blood loss, for example? Are there potentially underlying illnesses that make the cat vulnerable to anemia? For example, we know this cat had a retrovirus infection diagnosed some time ago, or it's a cat with chronic kidney disease where we know anemia development is an acknowledged complication of that. And we may also want to ask about exposure to toxins, perhaps exposure to other cats and infectious agents where at all possible, and pica as an indicator of often chronic anemia in cats, where the cat may start to eat cat litter or lick stones, have very unusual behaviour related to that, which often is a clue and often associated with iron deficiency in cats. And as I've already said, chronic anemia in cats often presents quite acutely. So the fact that the owner notices a sudden deterioration isn't always consistent with what's been happening in the cat, because they're so good at adapting to clinical issues and compensating for any lack of red blood cells by just adjusting their lifestyle and essentially being less active, for example, in the case of an anemic cat. And unfortunately, the image that we tend to have as owners of cats, of our cats, is that they are often quite sedentary. They spend a lot of time sleeping. Therefore, a cat that appears to be more sedentary or spending more time asleep is not necessarily spotted as being abnormal by our carers until perhaps it's relatively advanced. Once we move on to physical examination of our cat, then of course a key thing here is firstly going to be to confirm the pallor. If that's the reason the owner has brought the cat in this particular cat pictured, of course that would require the owner to have probably seen the cat with its mouth open, perhaps the cat yawning, to be able to report pallor to us, because this cat has a pigmented nose. But in some of the other photos that I've shown and will continue to show, the owners may notice pallor of the nares. The pink nose is now white, and that might be the reason that the cat is presented to us. But we may or may not need to actually lift a gum to look at mucous membranes before we can potentially agree with that owner assessment of pallor. And then following on from that, the other clues that we want to look for are going to be to tell us, well, what potentially is the cause of that pallor. Is this a very collapsed, very hypotensive cat? It's perhaps had some trauma, or it's been shut in a shed for several days without access to water. It's very dehydrated. You know, all of these things will be running through our minds as we examine our cat and try and understand in very simple terms really what potentially is the cause of the pallor. And more specifically, moving on to cardiovascular assessment, whether there is a cardiac reason for poor circulation. So can we hear an abnormal heart rhythm, a heart murmur, for example? Is there evidence of congestive heart failure in terms of muffled breath sounds or ascites? All these things are going to feed into our assessment and hopefully guide us down the appropriate route of differential diagnoses and appropriate tests. Other potential clues that might fit in with an anemic cat as well specifically would include things like jaundice. If we have a very severe hemolytic anemia, then that can result in a very quick deterioration in our red cell parameters, so a very rapid anemia, and the damage of those, or the destruction of those red blood cells on a very rapid basis, can overwhelm the liver's ability to conjugate the bilirubin and excrete it in the bile, and that can therefore cause a hemolytic jaundice. And so if our patient is both very pale and very yellow, that might be a clue that we're dealing with that situation. Some of our patients with hemolytic anemias will also have hepatosplenomegaly, and that can relate to red cell sequestration, extramedullary hematopoiesis as well, for example, so that might be a feature that we pick up. In a cat with FIP, we can also see an anemia that typically is not too severe, but jaundice and ascites may accompany that cat's clinical signs as well. So if it's a young cat in particular, perhaps a pedigree cat more often, that has that combination of signs, that might help us to again guide our assessment and our differential diagnoses. And I also put in, with respect to the Siamese story here, an example of a post-mortem example of hepatic amyloidosis, which is something that Siamese and Oriental breeds of cats are unfortunately more vulnerable to. And these cats can present with sudden collapse due to hemorrhage from often what has become a very friable liver. This liver doesn't need any trauma to make it bleed, but even the cat just jumping off the chair onto the floor, what would not be considered traumatic in any other scenario, can result in tears in the liver capsule and hemorrhage. And in a very mild form, the cat may appear to collapse, but then recover, and even within a few hours seem very much better. They auto-transfuse to a certain extent and they're not externally losing blood. But of course, if that hemorrhage is more severe, it can potentially actually cause death of the cat, or the cat could come in very collapsed and very pale with blood in its abdominal cavity. And ultimately, this isn't something, unfortunately, that we can treat. So therefore, if severe enough, it may result in death of the cat, and hence the post-mortem photograph included with permission of Professor Richard Mallock on this slide. So there are a number of clues that can help us in terms of our pale cat, But in general terms for anemia, if we're concerned about anemia as a possibility, the next step is to do more specific investigations with the aim of understanding more about that anemia. So is it present for a start? And the next question we want to understand is, does the cat have a regenerative anemia? Is there evidence that the bone marrow is producing more red blood cells and trying to correct that anemia, which would be consistent with either a blood loss cause of the anemia or a hemolytic anemia? Or conversely, does our cat have what we would call a non-regenerative anemia, where the bone marrow isn't really responding because of bone marrow disease, and that can be also associated with other chronic diseases like chronic kidney disease. So the haematology clearly absolutely integral part of our assessment in terms of determining answers to all of these questions. And it may also, we may see abnormal circulating cells in the case of some cats with leukemias. A quick PCV on its own is also very helpful in quantifying an anemia and, well, firstly determining whether or not our patient does look to be anemic, but also we can look at the plasma when we spin our microhematocrit tube down, and if the plasma is jaundiced and the cat has a severe anemia, PCV less than 20%, then that would be consistent with the possibility of a hemolytic anemia. And we may see also, if there's intravascular hemolysis, we may see actually red plasma on spinning down the tube in a patient with a hemolytic problem. So even this very quick test, an out of hours test often done, can give us some valuable initial information. But beyond that, we want to look more closely at our blood smear and also at the parameters we get on our haematology analyzer to try and determine, has this cat got a regenerative or a non-regenerative anemia? And if the anemia is regenerative, do we think it's appropriately regenerative? Is there good evidence that the bone marrow is responding positively, or is perhaps the response a bit weak? And that again leads us to ask questions about the bone marrow and influence of other systemic disease on its function as well. So I've put some clues of regeneration as a list on this slide. So that includes variation in cell size. Immature red blood cells are larger, so macrocytosis also can be a positive indicator of regenerative signs, but having just, rather than that uniform size of red blood cells on your blood smear, having varying cell size is certainly a clue to look for, and also variable cell staining on your blood smear. The immature cells will have still nucleic acid remnants within them, which tends to make them appear more blue staining, and again that variation in staining tells you have a range of maturity of red blood cells, and that's consistent with a regenerative response where we've got more immature red blood cells in the circulation. Presence of nucleated red blood cells and Howell Jolly bodies, so these nuclear remnants, also gives us a clue, if we see these in any appreciable numbers, that there is a regenerative response occurring. And we can also quantify the regenerative response by looking specifically at reticulocyte levels. And to look at cat blood smears for reticulocytes, the key thing to remember is they actually have two sorts of reticulocytes. So if we stain the blood with new methylene blue, which is the standard stain for reticulocyte counts, we will see that there is uptake in the red blood cells at some of the red blood cells that have these nuclear remnants, and that there are broadly two different appearances, what are called the aggregate reticulocytes and the punctate form of the reticulocyte. And the punctate form is the mature form of the reticulocyte, which tends to persist in the circulation for quite some time. So it's not really much of an indication of what the bone marrow is up to today. The reticulocyte that we want to look at is actually the aggregate reticulocyte, and this is the one that has these clumps of nuclear material which stains blue on the stain, and you can see both in that screenshot of the haematology smear and also in a sort of schematic form on the slide. So those are the ones that you want to count. They're normally present in very low numbers, and then we can use our count to actually determine whether the regenerative response is appropriate or not by using this calculation. And essentially we want to look for a reticulocyte count of 50 or higher as indicating some evidence of regeneration, but the higher the value, the stronger the regenerative response is. Bear in mind that it does take some time for a regenerative response to be initiated. So if our patient loses blood acutely, it will take 3 to 5 days typically for a regenerative response to be visible on their blood smear. So we may need to do some sequential monitoring to determine that there is an adequate regenerative response if we're concerned that perhaps we're looking a bit sooner than is appropriate in our patients. But obviously the greater the regenerative response, the more reassuring it is that the bone marrow is responding appropriately. There are some other clues on our haematology that we can look for. So macrocytosis, I mentioned, can be associated with a regenerative response because immature cells tend to be larger, but also macrocytosis can be associated with some bone marrow dysplasias and problems, for example, FELV associated issues. So it's not always good news to see a macrocytosis, but it certainly is useful information for us to see. Spherocytes can be associated with immune-mediated hemolytic anemia. Microcytosis, and particularly if the cells are hypochromatic, if they're paler staining on our standard blood smear, then that is consistent with iron deficiency, which can be an issue for some cats. For example, some cats with chronic kidney disease that have chronic blood loss as a contributory factor to their anemia. And lastly, if we are aware that there is a pancytopenia, a loss of all of the cells produced by the bone marrow, so not just red blood cells but also white blood cells and platelets, then that would tend to indicate that there is a bone marrow problem, and that's the next place to look. And I've included actually on the right hand side here a picture of a bone marrow smear from a cat with pancytopenia, where this is a very specialist job to analyse. So I've been told, I did not read this bone marrow smear myself, that this was a myelodysplastic bone marrow, and actually what you can see in the centre of that image is a mitotic figure. And there were increased numbers of mitotic figure and very abnormal looking cells in this poor little cat with bone marrow disease. So our haematology definitely can give us useful clues and pointers as to where to go. But ultimately, the main purpose of the haematology, we hope, is that it's going to tell us, is the anemia regenerative or is it non-regenerative? And if it is regenerative, that narrows down our list of differentials to hemolytic causes and blood loss, and that blood loss can be external. The picture there is of a cat with a heavy flea burden actually on the ear, but it could also include gastrointestinal blood loss, so that also ends up being external to the body. Of course, with hemolytic anemias, many differential diagnoses, some of which will be mentioned in a subsequent slide. On the other hand, if our anemia looks non-regenerative, if the bone marrow doesn't appear to be responding, then that is the place that we need to concentrate on. And there are a number of systemic diseases that will be associated with non-regenerative anemias, which range from many chronic diseases where just there is a chronic mild non-regenerative anemia associated with that, through to possibilities, again mentioning chronic kidney disease, another favourite topic of mine, where one of the contributory factors is a lack of erythropoietin production by the damaged kidneys, so there's less of a stimulus for new red cells to be produced, as well as potentially more blood loss through gastric ulcers, for example. And then in these non-regenerative anemias, obviously we need to look more generally at the systemic health of our patient and potentially at the bone marrow itself. So beyond those initial testing options, beyond our initial haematology, there's potentially a lot of other avenues that open up. In general, we would always be keen to do a thorough blood panel, which includes serum biochemistry and also to look at urinalysis as part of our general healthcare assessment of any patient that's presented to us. And our biochemistry can give us some useful clues depending on the cause of the anemia in the cat. So some of those clues can be quite non-specific. For example, we often do see some increase in liver enzymes due to hypoxic impact on the liver, so that's just something to be aware of. But in the case of hemolytic anemia, of course, we may see a jaundice if that anemia has been rapid and severe enough to overwhelm the liver's ability to conjugate that bilirubin, so increased bilirubin present on our biochemical assessment. Total protein, typically low normal if blood loss is responsible for the anemia, whereas it tends to be normal to high for many other possible causes. Evidence of CKD, of course, might be come through on our biochemistry and fit well with a more chronic anemia in an older cat in particular. If we have a diabetic cat, one of the things we need to keep an eye on is phosphate levels, because hypophosphatemia can cause hemolysis. So there are a number of ways that, as you can see, our biochemistry panel can contribute usefully to our anemia assessment and even offer some treatment opportunities and recommendations for us. Urinalysis can be helpful also just in confirming jaundice, evidence of hemolysis in a patient with anemia, and then of course there are infectious disease tests that become appropriate depending on the patient and what we're considering. So for hemolytic anemias, again, the hemoplasmas, Mycoplasma haemophilus for example, would be an important differential. So PCR testings for panels of hemoplasma infections, our retrovirus testing of course, and we may have also concerns over FIP. As I've mentioned, if we have a jaundiced young cat with some anemia, we may want to consider appropriate diagnostics for that, and that will open up another whole avenue of possibilities, including looking at the eyes for inflammatory lesions, doing some imaging to look for fluid production in the chest and or abdomen, granuloma formation. So you can see within the confines of this lecture, it's obviously not possible to present an absolutely complete diagnostic approach to all of these possibilities, but hopefully I've shown you some of the steps towards answering the initial questions that are then going to guide you down which route to follow after that. And of course, from a haematology perspective, as on the bottom point of the slide, there are other things that can be done to look for evidence of immune-mediated hemolytic anemia as well, such as our slide agglutination and Coombs test. So there are a whole host of possibilities, but we hope that by doing that initial broad, sensible history, physical examination, patient assessment, and importantly our haematology assessment, that it allows us to focus on the key abnormalities and therefore to understand which is the relevant diagnostic path to go down afterwards that's going to get us to the correct diagnosis and therefore the correct treatment for this particular patient. So key messages really are so much we can get out of our haematology assessment. So I hope that's been a useful mini lecture. This is a screenshot of my website, vetprofessionals.com, where I have a lot of resources that are free to access, both for veterinary professionals and also for pet owners, and I hope you will consider paying a visit there. I'm also a consultant for virtual veterinary specialists, which may be a service you're familiar with in other disciplines, but if you have feline cases you'd like to discuss with me through the VVS platform, I'd always be delighted to help. And as I mentioned at the start, if you do have questions or you would like a copy of the PDF of the slides I've used in this presentation, then you're welcome to email me. If you just mention it's the My Cat is Pale talk, I will know which presentation you're referring to. And on that note I'll finish, but I hope you found this a useful session. Thank you very much.